acanthosis nigricans. And you may be like, Doc, what is that? Doesn't mean I have diabetes. Let's talk about it. First off, acanthosis nigricans describes a skin condition where you have a thickening, darkening of pigmentation, usually around the skin, and it has almost like a velvety-like consistency. Found around the neck, sometimes underarms, and the growing area as well, is where it can be present, and usually it's a sign of another condition that's underlying. So what are some of these conditions? Some may revolve around obesity as well as insulin resistance. With the increasing rates of obesity that we're seeing, particularly among children, teens, and above, really want to make sure that we're screening, particularly for metabolic disorders such as high blood pressure, high cholesterol levels, and even diabetes. In regards to insulin resistance, we can sometimes see this as well, not only in diabetes, but sometimes in polycystic ovarian syndrome or PCOS as well. Could it be caused from a medication that we're taking? Certainly. We want to think about medicines such as insulin. Are we taking steroids, hormonal therapies such as oral contraceptive pills, and maybe even some mental health medicines, to name a few, are some that we want to consider. And rarely in our older patients, there may be an underlying malignancy, and malignancy means cancer, that we want to consider if acanthosis evolves suddenly, there's a change in their weight that's unintentional. And also you may have acanthosis in rarer places, such as the palm of their hand or the soles of their feet. So that's where we want to think about, okay, is there underlying malignancy in our older patients that we need to consider? So how do we treat it? What do we do? Again, the most important thing we can do is treat the underlying condition. We want to make sure that we have that under control and that it's being treated adequately. Next, if need be, do we need to think about the dermatologist? Do we need to think about endocrinologist that specializes in metabolic disorders that may be uncontrolled? Those are certainly possibilities. Here's what we don't want to do. We don't want you to scrub your neck so hard where you actually worsen the problem by causing what's known as lichenification. That is where the skin actually becomes thicker and that discoloration can actually worsen. Please try to avoid that at all costs. So I hope this information has been helpful for you.